BiMonthly Breastfeeding Coalitions webinar. I'm Kinkini Banerjee, the Senior Coalitions Manager at USBC, and I'm so glad to have you join us for this very special presentation to mark the National Breastfeeding Month. This series is jointly hosted by CDC's Division of Nutrition, Physical Activity and Obesity, and by the USBC. The webinars are held every 2 months on the second Tuesday of the month from 2 to 3 p.m. Eastern, and are referred to as the 222. And the purpose of the series is to bring together breastfeeding coalitions to share best practices and news, and to network and collaborate on issues of national significance. All webinars are free, and the access is open to any coalition member, breastfeeding advocate from across the country. You could join the coalition's Learning Connection to get all our announcements, and the topics and speaker details are posted a week or two before each session on the public website. So you can go to www.usbreastfeeding.org/coalitions-webinars, or just join our learning community and you will get all the announcements. And for the last year, we've streamlined the access, and these webinars have now been set up as a series. So once you sign up for a single webinar, you're pretty much signed up for the series, and you will get the periodic notifications for them about the presenters, about the topic, and also reminders with your link to join in. We record all sessions. So you can go, we know that it's hard for folks to join in the middle of the day or of the workday sometimes. So all our sessions are recorded, and you can go to find our archives on the webinar page at www.usbreastfeeding.org/coalitions.webinar. And so this is where you find them. If you go to our website and see the tabs across the top, the last one is the Coalitions tab, and just click on it and you'll see our webinar series, the CDC-USBC bi-monthly webinars. Click on it and it'll take you to that page. And you'll also be able to download the presentation slides from this one and previous ones, any other handouts, as well as the video recording. So we all attendees are in listen-only mode for this session. However, we encourage you to submit your questions either throughout the session, throughout the presentation. So we will save about 15 minutes for Q&A at the end. So here's how you do it. On the right of your screen, you should see something like this. And if you don't see it, just click on that orange tab with the white arrow, and it should pop back out. And scroll through the tabs, through those blue tabs, and just under the audio tab is the questions tab. Click on that and it'll open up a text box for you to type your question in. So please, we'd love to hear from you, and do type in your questions. And if you have any audio or other issues, tech issues during this session, please email coalitions@usbreastfeeding.org, and someone will be able to help you. That brings me to today's topic, breastfeeding public health partners, collaborating for change from the local to national levels. So we are so glad to have one of our public health partners, Nature, the National Association of County and City Health Officials, present today's session. And this webinar will emphasize the role of breastfeeding as an issue of critical public health significance. We know that our audience spans many different sectors. We have folks from community, we have folks from healthcare, from public health, many other sectors, families and moms represented. And so just to kind of lay the framework of how crucial breastfeeding is as a public health issue, you'll also hear about the multi-level collaborative efforts and partnerships that are happening at the national level, so that the diverse needs and perspectives in the breastfeeding field are represented, and there's better coordination and collaboration between the many entities that are funded to do this work, so that we can leverage each other's strengths and also build on our scale and impact. So with that, I'm going to introduce our speaker, Our first presenter is Sade Oshibanjo, who's a program analyst at Nature, and she provides the day-to-day technical assistance on a whole aspects of program implementation on their Nature's breastfeeding project, and also serves as a liaison between Nature and organizations seeking resources on peer and professional lactation support. Before joining Nature, Sade worked in Zambia with the United Nations World Food Program on a national school feeding and program, and served with the US Peace Corps from 2011 to 2014 as well. Her expertise is in maternal and child health, food security, poverty alleviation, and gender equity and women's empowerment. We're so thrilled to have Sade with us today. Our second presenter is Harumi Rice-Riley, and many of you know Harumi from the projects that Harumi is a lead analyst for the breastfeeding project at Nature. She's responsible for training and technical assistance content delivered to funded local communities providing breastfeeding support. Harumi has a Master of Science in Health Programs Management and a Bachelor's in Nutrition. She's multilingual, a health educator, and IBCLC, and she has been working in the field of MCH as well and chronic disease prevention and in private practice for a decade now. The proudest part of her career is her second shift, that she calls it, after she gets home from work and gets to hang out with her three guys, a breastfeeding toddler, Joey, big brother, Tommy, her husband, and her beagle, Pumpkin. So welcome, Sade and Harumi, and I am now going to turn it over to Sade. Sade, you might be muted. This is Kinkini.
Thank you for the introduction, Kinkini. Hello, everyone. This is Sade speaking. You would hear from my colleague Harumi during the second half of our presentation. Funding to support facilitating the Breastfeeding Public Health Partners Group was provided by CDC. However, the views expressed in today's presentation do not represent those of the sponsor. As Kinkini mentioned, our objectives are to define breastfeeding as a public health issue, describe the purpose of Breastfeeding Public Health Partners. We will also talk about prior and current work of its members, and finally we will discuss the collective work of these partners and their next steps. So in terms of defining breastfeeding as an issue of public health significance, so what is public health? It's the science and practice of saving lives, and as public health professionals or practitioners, we seek to protect and improve the health of families, communities, and populations by implementing programs that promote health behaviors or lifestyle. We work on injury prevention or try to detect diseases before they become widespread. Another important function of our work is eliminating health disparities by ensuring equal access to quality and affordable health care. So in terms of looking at the core functions of public health, this diagram from the Department of Health and Human Services underscores the 3 core functions of public health, as well as the 10 essential public health services. In terms of assessment, there are various tools currently being used to assess breastfeeding support practices. The Maternity Practice in Infant Nutrition and Care, MPINC survey, is administered every 2 years to assess the breastfeeding support practices of hospitals. In addition, WIC departments collect information on breastfeeding rates, while national breastfeeding rates are collected through the CDC's National Immunization Survey. Over the last few years, several federal policies have called for increased support for breastfeeding. There are also community-level support and state-level policies. These policies highlight the many health benefits of breastfeeding and the need to support women who want to breastfeed. The 2011 Surgeon General Call to Action is a very good example of this. It outlines 20 action steps to support breastfeeding, and these action steps have guided much of our work around breastfeeding. And with regards to assurance, our goal is to build the capacity of people and institutions providing lactation support. So through various programs such as the Reducing Breastfeeding Support through Peer and Professional Support that Nature did, we, for example, can evaluate the impact and effectiveness of programs that are trying to do just this, build assurance. However, more work still needs to be done. Currently, the lactation field is not well connected to public health, and there is a need to strengthen the alliances between these two entities. Breastfeeding support can be found throughout CDC's priorities. Organizations such as WHO, World Health Organization, American Academy of Pediatrics, ACOG, American Congress of Obstetrics and Gynecologists, American Public Health Association, American Nurses Association, and others, all have policy statements that promote breastfeeding. Other federal agencies engaged in work around breastfeeding include URSA, and there are several national profit organizations who receive federal funding, including BPHB, National Head Start, LT Start, to fund work at the state level, as well as in multiple territories throughout states, and giving these funds to local agencies, coalitions, hospitals, and clinicians to do breastfeeding work. The LT People 2020 indicator serves as a core public health indicator for breastfeeding. And as you can see in this slide, there are several targets for breastfeeding indicated. According to the National Immunization Survey on Breastfeeding, disparities in breastfeeding initiation and duration rates still persist across racial and ethnic groups, despite improvement in overall breastfeeding rates. And as you can see, African American women have the lowest breastfeeding initiation and duration rates of all racial and ethnic groups. It is important to keep in mind the structural barriers that prevent moms from breastfeeding. We need to be cognizant of the systems and structures that make it challenging for moms to breastfeed. For example, a mom who lives in a community with few or no lactation consultants or peer counselor, or a mom working for an employer who does not offer adequate support if she needs to breastfeed, when she returns to work, may have a more difficult time meeting her breastfeeding goals. In comparison to other races, a disproportionate number of African American moms are younger, single, and have less than a college-level education, and have a lower socioeconomic status. An ongoing effort in public health community is to increase breastfeeding rates within African American and other underserved communities with low rates of breastfeeding. The overwhelming health risk of not breastfeeding makes low breastfeeding rates in any population a public health concern. But it is particularly problematic for African Americans because the benefit of breastfeeding for infants and moms may be more significant for this population. In terms of breastfeeding and health inequities, exclusive breastfeeding reduces infant mortality from childhood, diarrhea, pneumonia, and promotes a fast recovery for the infant from sickness. Breastfed babies have a lower incidence of obesity later in life, and breastfeeding is also associated with a 36% decreased risk of sudden infant death syndrome, or SIDS. In a study by Chen and Rogan, researchers found that infants who were ever breastfed had a 21% reduction in odds of post-neonatal death. African American babies have more than double the risk of dying before their first birthday than do their white counterparts. Higher rates of preterm and little birth weight deliveries among African American women explain some of the gap in infant mortality, but research also points to breastfeeding as a possible solution to mitigating the burden of infant death in African American communities. Getting more women to nurse longer and more exclusively can narrow the race gap in post-neonatal infant mortality. It is important to note that the duration of breastfeeding is also very important. Those infants who breastfeed for 3 months or more have a 38% reduction in odds of post-neonatal deaths compared to infants who have never or ever been breastfed. The three breastfeeding promotion strategies are those that the CDC has identified as priorities. Specifically, the Division of Nutrition, Physical Activity, and Obesity is currently working on these strategies to address their priorities. And we'll be talking about these strategies in more detail in the coming slides. So the first strategy is implementing the 10 steps to successful breastfeeding. This first strategy supports effort to monitor maternity care practices in hospitals through programs such as the MPING survey. The survey is customized and returned to hospitals to help improve maternity practices to facilitate increased initiation rates. CDC's Division of Nutrition, Physical Activity, and Obesity is also supporting hospital efforts to become baby-friendly. Most recently, CDC funded ABS Associates to support empower hospitals to move forward towards baby-friendly designation. These hospitals are at various levels of needs and progress on the 10 Steps program. The second strategy looks at assisting with the implementation of worksite lactation support and focuses on increasing business and employer understanding of federal laws to accommodate breastfeeding employees. By helping employers understand the law and how it should be implemented, more states will be in compliance and women returning to work will be able to obtain adequate workplace support. In addition, CDC is providing evidence and resources to employers about the overall benefit of supporting maternity and family medical leave, preferably both of which would be paid. And for the third and final strategy, increasing access to peer and professional support for breastfeeding. This strategy centers on increasing access to breastfeeding through peer and professional support activities. Efforts that contribute directly to better access to breastfeeding support and the current level of support offered are outlined in CDC's breastfeeding report card. In addition to the report card, CDC provides funding to the National Association of County and City Health Officials, NATO, ASTO, Association of State and Territorial Health Officials, to implement community and state, respectively, approaches to increasing access to peer and professional lactation support programs and services. CDC is also working with the United States Breastfeeding Committee to strengthen state and local coalitions and partnership for breastfeeding support. And this map reiterates and shows all 50 states are currently being funded for public health breastfeeding initiatives, either through NACHO, National Association of County and City Health Officials, through the APT Associate for Empower, being provided to local health departments, as well as other state-level coalitions by Association of State and Territorial Officials, or through the Enhanced 1305 awards to state-level health departments. And my co-presenter, Arumi, will talk about the breastfeeding public health partners and their work coming up.
Good afternoon, everyone. Thanks, Shade, for this very informative background on public health breastfeeding. It's a pleasure to be here speaking to such a great audience of breastfeeding coalitions, advocates, and lactation support providers, colleagues. So now it's the time that we will dive in on what the BPHP, which is the Breastfeeding Public Health Partners, what the group is, and what the partnership do. We're going to also talk about the members' individual work of addressing the multiple needs in the public health breastfeeding field. So what's behind the name Breastfeeding Public Health Partners? Shade talked a lot about breastfeeding the public health context, so what's behind our name? You see there our partners, but Breastfeeding public health. When an ordinary person in the street think about breastfeeding support, they usually think about work being done in the hospital just right after a mom had a baby, trying to latch that baby, or maybe a nurse or pediatrician helping them put the baby at the breast at their office. So usually people think about individual support being done in a clinical setting. However, there's a lot more happening in the public health field. So all mothers can access this crucial support they need. And there's a lot happening within the public health organizations trying to improve those PSEs, which is the policy, system, and environment around breastfeeding, which includes access to high-quality care, training of multi-level public health professionals on breastfeeding, creation of breastfeeding-friendly practices, and also work on advocacy for national policies such as paid maternity leave, and all the work is always done with a focus on equity in breastfeeding, as Shade explained earlier. And to coordinate all these activities is the reason that the Breastfeeding Public Health Partners was convened. So the Breastfeeding Public Health Partners is a collaboration of national public health agencies and breastfeeding organizations that has major programs and activities around breastfeeding support. Originally, this partnership was convened by NATO to avoid duplication of breastfeeding activities funded by CDC. However, it was identified that some voices were missing at the table, so we added some other organizations doing breastfeeding work as well. And each agency, as we will learn today, working different unique aspects of public health. So they complement each other. The purpose of the group is to inform the various project activities, increase resources and information about breastfeeding support, and improve collaboration and coordination of these breastfeeding support activities. And the activities are focused on 3 primary strategies, which aligns with the DNPAO strategies that Shade explained. So it's maternity care practices, breastfeeding, peer and professional support, and workplace policy and accommodation. So mainly, the main purpose is to maximize every federal dollar invested in breastfeeding programs through the leveraging of efforts so we can achieve collective impact. Next. So the first partner that we're going to talk about is MCHIP. They do a lot of work related to Affordable Care Act support for breastfeeding, support state efforts to improve breastfeeding rates. So you can go to their website for their issue briefs they develop on this topic. So there's the health reform and breastfeeding and state opportunities and strategies for breastfeeding promotion through the Affordable Care Act. They also conducted a pilot project with Arkansas Breastfeeding Coalition to provide technical assistance to local businesses around workplace lactation support and accommodation. And CHIP also works with the Title V Maternal and Child Health Block Grant Program, which is the nation's oldest federal-state partnership. The goal is to improve the health and well-being of women and children, and they have national performance measure for breastfeeding initiation and exclusively through 6 months. So breastfeeding work occurs in 49 jurisdictions in the areas of hospital, workplace, partnership with WIC, home visiting, and other community agencies. They also have initiatives around father and family support. So their next step is to disseminate best practices, provide technical assistance to 4 states on workplace support, and how to develop a policy. They're also hosting a webinar series on increasing IBCLCs of color, which is much needed in the lactation providers field. The next partner is OSCO. So OSCO is a nonprofit membership association, and they represent the state health agencies in the U.S. territories and freely associated states. So in 2014, OSCO was funded by the CDC to start this project focused on improving breastfeeding rates across the country using a learning collaborative model. They funded 19 states to work in those 3 areas, so each state could choose what they wanted to work on. So it's breastfeeding in birthing facilities, improving access to peer and professional support, and increasing compliance with the federal lactation accommodation law. So each state received $15,000 to make systems level change designed for sustainability and spread across the state. So the lead agency was most often the state health department, with a still working with their state breastfeeding coalition. So if your coalition is included, you may have received funds as well, and you're already familiar with this project. So 5 of the states also received an additional $15,000 to develop stronger collaborations between state health agencies and the coalition. So now for year 2 activities, OSCO launched the year 2 of their breastfeeding learning community, and they will facilitate another 3 virtual learning sessions to help facilitate cross-collaboration and sharing across state teams. And they're trying to identify the state's technical assistance needs. And states will continue to work on their key strategies, working to spread successes and create sustainable interventions. So their major successes, next slide, is they were able to train over 800 healthcare professionals, and other 500 hospital-related professionals attended their breastfeeding summits. They developed several materials and implemented policies and practices in hospitals, work sites, community, and they changed practices in these venues. And states also increased the number of breastfeeding-friendly facilities, such as through their own state designation program, roughly 80% over baseline. So great work there. The next member organization is ASPHN, which is the Association of State Public Health Nutritionists. So they provide state and national leadership on food and nutrition policy, programs and services. And their main breastfeeding work is around the pediatric obesity mini coin. So their approach is more breastfeeding as a health infant feeding to prevent childhood obesity. They developed a brief highlighting the integration of clinical and community and public health systems. And they include examples of breastfeeding promotion and management. And they have some stories from the field, as you see in this picture there, about home visiting for breastfeeding support. They also conduct an action learning collaborative to support state efforts. And you can go to the website to watch archived webinars of this pediatric obesity mini coin. And our next partner is Carolina Global Breastfeeding Institute, or CGBI. Their mission is to promote increased quality of care and create an optional breastfeeding norm through research, services, and training. So they work a lot with breastfeeding, and their approach prioritizes the reproductive health continuum using the 3 B's. It's birth, breastfeeding, and birth spacing. And they include attention to local, national, and global health issues that impact the mom and baby dyad. So they have multiple breastfeeding projects, as you see there. I'm going to just mention the first row and the third row. First is the Ready, Set, Baby prenatal curriculum. It's a breastfeeding curriculum. And now they're training WIC nutritionists to use them in their practices to educate their clients. And they're free to use. The curriculum is excellent. You can just go to their website and download. They also have Empower, as Shade mentioned. So CGBA partner with PED associations to help around 100 hospitals, it's a little under 100, help hospitals to achieve the baby-friendly designation in communities where breastfeeding rates are low. And they also developed the breastfeeding-friendly childcare tool. So again, you can go to the website and download if you're not familiar with them. They have the 4th trimester project. The goal of this 2-year project is to bring together mothers, healthcare providers, and other stakeholders to define unmet healthcare needs during the 4th trimester, which is the first 3 months, right, after birth. And finally, they have the Breastfeeding and Feminism Conference, which is a breastfeeding conference focusing more on the socio-economical structural barriers to equity in breastfeeding. So if you have never been to one, you should definitely go. It's usually in March every year in North Carolina. And the next partner is actually us, NACHO, the National Association of County and City Health Officials. So we are a membership association providing technical assistance to 2,800 local health departments across the country in all areas of public health. And in 2014, the Safe and Healthy Families team received funding from CDC to select agencies in local communities to provide evidence-based and innovative peer and professional breastfeeding support in underserved and African American communities. So we funded 72 projects, and it was mostly delivered by local health departments and community-based organizations. But we also had local hospitals and local coalitions in our pool of grantees. So we have a community of practice to promote peer learning, sharing of resources developed, so they don't have to keep reinventing the wheel. And our team provided over 1,000 hours of training and technical assistance to this organization. And here on the right, on this world map, there are some activities that our grantees did. It was building staff capacity to provide breastfeeding support, education and training of lactation providers at multiple skill levels, creation of referral systems, and marketing and virtual support, platform development. It was established more than 800 community partnerships, and more than 3,000 support groups were held. But to know more about the specific results and what really works for community breastfeeding programs, you're going to need to come to our webinar on August 31st. I'll be sharing the link shortly. So our next step is the Public Health Breastfeeding Webinar Series. If you'd like to engage more in this conversation of breastfeeding with the public health outlook, we're going to explore what public health professionals and entities can do to improve breastfeeding disparity rates and rates overall. So we all together can achieve and surpass the 2020 Healthy People goals. We also have a capacity building bootcamp for local organizations on program implementation. We learned that many community organizations could use more support on grant writing, budgeting, program implementation and management, and evaluation of the data in the program itself. So NACHO next steps also include disseminating the good work done through journal articles and fact sheets, and we will also continue to facilitate the BPHP group. So here's more details of our webinar series there. So it's going to be a 6 sessions webinar. We're continuing education, CDC continuing education are pending for this series. And why we want to promote the promising practices and share lessons learned from our project that was the Reducing the Breastfeeding Disparities through Peer and Professional Support. It was the largest nationally coordinated implementation of community-level breastfeeding support. The topics will focus on identifying public health solutions and promoting equity in breastfeeding for underserved communities. And the topics will be the continuity of care, maintaining hard-to-reach groups, ensuring sustainability through billing, building sustainability through policy, systems, and environmental changes, so that's PSE that I talked earlier. So the first webinar is on August 31st. It's going to be during Black Breastfeeding Week. And the first webinar, the title is Breastfeeding in the Community, Implementations That Work. So the webinar will pinpoint what worked in the field and identifying implications for current and future public health breastfeeding initiatives in the community. So the next partner on the next slide is National WIC Association. And keep in mind, this is National WIC Association. It's not WIC or it's not USDA. It's not a WIC program. So the National WIC Association is the nonprofit education arm and advocacy voice for the WIC. And that serves over 8 million mothers and young children and the 12,000 service provider agencies who are the front line of WIC's public health nutrition services. So WIC promotes utilization of peer counselors to support breastfeeding, and they create training opportunities for the connection of hospital and peer counselors. More breastfeeding work has been done with funding from CDC, and the project funded was entitled Community Partnerships for Healthy Mothers and Children Project, Improving Nutrition and Healthcare Access for Families. So the American College of Obstetrician and Gynecologists, ACOG, is a formal partner of National WIC on this project. They are supporting 36 agencies to help improve intake of health foods, beverages, increase the use of community-based resources to better control chronic disease, and increase breastfeeding initiation and duration rate. And also strengthen referral network between WIC, healthcare, social services, and other community resources. So for that, they are convening multi-sectoral coalitions to conduct community needs assessment and implement a community action plan. And next here we have USBC, and Kinkini is going to speak on behalf of USBC.
Thank you, Arumi, and there's just so much good information that you all are sharing that I'm going to just whiz really quickly through USBC. Most of you do know. USBC is a coalition of more than 50 national organizations and federal government agencies, and also a vast network of state, territorial, tribal, local, and cultural breastfeeding coalitions. And our mission is to drive collaborative efforts for policy and practices that create a landscape of breastfeeding support across the United States. So one of the things that we really bring to our networks is that a lot of the resources and referrals through our website, through our different capacity building technical assistance that we provide to our network. Next slide, please, Shade. And as both Shade and Harumi have said, that some of the priorities are those 3 streams that you see: the maternity care practices or 10 steps, the peer and professional support, lactation support providers, and workplace and policy accommodation. So USBC is funded by CDC in 2 of these, the lactation support providers as well as the workplace policy and accommodation. So you have Amelia Smythe, our Deputy Director, who leads some of the the lactation support or support provider work that we do, and Cheryl Lebedovich leads the work that we do with workplace policy and accommodation. And we also get funding from the W.K. Kellogg Foundation, and a big core of what we do is to mainstream some of the racial equity values and practices within USBC and within the field. So we have learning communities with our webinar series, and we do the coalition capacity building too. And as you've heard from Shade and Harumi, this network of partners that we have brings so much in terms of capacity building help. You just heard about the whole series and the terrific capacity building, as well as ASTO, and all of these other groups have some form of learning collaborative, some form of peer networking and sharing. USBC also uses technology for a lot of coalition capacity building, so you can see that the website that we launched is more of a platform where you can go and have set up your the work that you do. It's a collaborative platform that helps you find folks who are doing work in your area, or you can find organizations and entities doing work in other areas organized by the Surgeon General's call to action, the different action directories. Next slide, please. And so, yes, as we said, the Capacity Building Learning Collaborative is a big one. Next slide, please. And I'm going to now turn it over to Harumi again to discuss the collective work and next steps that are happening.
Thanks, Kinkini. So yeah, we talked about what each agency does individually, but what does BPHP does as a group. So as a group, we meet monthly, both virtually or in person, to discuss updates, share successes, and new opportunities to work together. We have also presented in several conferences, and we are always showcasing each other's work. And last weekend at the USBC Coalition conference, each partner presented about their individual work. So our partnering priorities are those three you see there. The first one is joint advocacy from public health partner organization leaders. So, for example, USBC was leading the coordination of drafting a letter signed by our public health agencies to Secretary Burwell to clarify points of the Affordable Care Act breastfeeding coverage. It wasn't really clear what they meant. So that's one of the efforts. The second was promote grantees to build the evidence and share best practices. So this activity was selected because we know, and I'm sure you know as a state coalition, the great work being done on the ground, the breastfeeding services and the community programs. But as lactation providers, we are sometimes so busy seeing moms and babies, and we forget about collecting data, evaluating our work, getting published, building the evidence to, evidence that what we do is effective, so that work can actually get replicated in other communities. So that's the goal there, to promote grantees. So we're encouraging and supporting projects to get more business professional, disseminate the results, things like that. The one is sharing resources and landscape at community, state, and national levels. So this one's pretty much so we don't keep reinventing the wheel. This activity is based on leveraging efforts. The manpower and efforts that take to develop new resources. However, there are great resources out there already, developed by different local, state, and national agencies. So it's applicable to the work we do, and our collective grantees do too. So we just share those resources so everybody can use. And this fourth one, the blue one, that helps states and communities understand breastfeeding support roles. We identify as a priority, but we haven't developed that much, except the work that USBC does with the coalition. So this is about examining our work. An important factor in any partnership is a willingness to revisit the priorities you set and make necessary adjustments to what is happening within the partnership and in response to outside forces. So you see there in this image the big ideas that came out of our first strategic plan, but they're not necessarily things that we plan to work on moving forward. So priorities change, and every year BPHP partners gather to do strategic planning to identify these priorities again for the next year. So I already talked about the top needs for breastfeeding for last year. And then most recently, in April, we had an in-person strategic planning session. And we met to determine what worked, what didn't work, what we can do better in terms of carving out the priorities and activities of the partners. So we conducted this SWOT analysis. If you're not familiar with that, that's the finding our strengths, weaknesses, opportunities, and threats. And so we saw that we collaborated well. Weaknesses is, of course, we don't have enough time to focus on this work. And doing the work of BPHP is not well integrated with our daily deliverable. The opportunities is that we agree that public health lens is important, and we seek to promote equity and anchor breastfeeding with other maternal-child health issues. And threats, it may be that we don't have enough voices. We have so many breastfeeding groups, and we do not wish to create the same group of people over and over. So it's important to create a unique lens. So next here, just last month, a few weeks ago actually, we met again twice as a group to come up with our vision, refine priorities, define our unique work in the field, like individually as an agency, and unique work as a group, and our critical space that we occupy between federal government and state and local agencies, and also how each organization contribute to each other. And again, like I said, to identify which voices are missing from the public health arena. So it's a work in progress, as it is with any partnership. And that's all I have for the BPHP for the moment. And here, as I said before, that's our webinar with the link. So it's our first webinar is going to kick off on Black Breastfeeding Week, August 31st. You can go to breastfeeding.nature.org to register. And I think we can open up for Q&A. Kinkini.
Thank you, Shade and Harumi, for a fantastic presentation, and so helpful as you see that this partnership of coordination helps, we hope. It's such a dynamic collaboration too, and as we work to build our own priorities and what we should be focusing on, as you said, annually we do that, we hope that it'll bring value, A, to the population that we are committed to serve, B, to the sub-grantees that, the state coalitions and the other entities, the public health, the hospitals that we are working with, and then also in the partnership to each of these partners, because then we are learning what works best, what's needed in the field, what the gaps are, what should we do to make sure that there is enough capacity building support for the first food field. So this is really terrific. We're open for questions, and I'm going to read out. So we do have some questions about, examples. Give us some examples about things that I'm trying to find. Can you give a brief example about your worksite, how something, one of your worksite grantees is implementing their program?
Hi, Kinkini. Let me repeat the question just if I understand. You want to know more about the examples that our grantees did on the ground?
Yeah, just one example of one of your sub-grantees doing work with WorkSite.
With WorkSite. That would be mainly with Nature or with
That's right,
OSCO.
because you're doing the, yes, you're doing the
we
peer
did
support the community.
Yeah, we did have a lot of our communities supporting as a consultant to businesses in their community to create rooms and even establishing policies of breastfeeding support policies within their organization, like their health department, or within the business communities.
That's right. And also there was one question about the prenatal education that you're given, that lots of mothers sometimes come to the hospital not having had enough breastfeeding education during their prenatal or their first, second, or third trimesters. And I know that through the work over here, a lot of that is the community-based support in the prenatal as well.
Right. Yeah, it would be step 3 on the 10 steps to achieve the baby-friendly practices. Correct. So yes, our communities served as step 3 and step 10 for many of the local hospitals. And I don't know if someone is asking about the curriculum that CGBI developed. That is a very good curriculum that some of our grantees actually use, the Ready, Set, Baby curriculum.
Mm-hmm. Yes.
I don't know if, okay.
The Ready, Set, Baby. And we will give you links to all of these partners. Even there are some in the slides itself, but each of these entities, we will make sure that we have links available for you so you could visit their websites and see. One question about being able to join. So now each of these agencies have learning collaboratives and also webinars. So the question is that if you're not a grantee or you're not funded by Nature or OSCO, could you still join the webinar and access it?
Yes, I'm not sure about OSCO, if you can join their Learning Collaborative, but our next step is actually publicize the work being done with our first 2 years grantees. So we're not having grantees at this time, but we are having the webinar series for everyone interested. So that link that I shared earlier, the breastfeeding.nature.org, is open to all. And please share the link if you within your organization.
Wonderful. And your previous ones that you did with the grantees, you did a lot of great capacity building work where that folks can access them.
Yes, the same link, the breastfeeding.nature.org. We have our archived webinars. We have a great one in community engagement and recruiting mothers. We identified the main struggles that the grantees had, and then we developed this webinar.
Right.
And that's what we're going to focus to in the bootcamp capacity building for local organizations.
Yeah, just all the different things that you're going to be doing, data and evaluation and grant writing, are just things that Coalition so needs. So thank you again, Shade and Harumi, so much. And I'm going to now turn it over for CDC updates. And we have Paulette Murphy, who's the Deputy Chief from the Nutrition Branch, the Division of Nutrition, Physical Activity, and Obesity, or the DNPO, as we call it, CDC. And Paulette, welcome. Very glad to have you here.
Thank you, Kankini. And thank you to Shade and Harumi, and you, Kankini, too, for talking about all these exciting breastfeeding projects and the Breastfeeding and Public Health Partnership. There's just so much going on, and it's just exciting to hear about it, even though I've known about it. But the way y'all express it is just great. So I just wanted to give a quick update on what's going on here at CDC. And as many of you've heard, we're delighted to announce that our division now has a new permanent division director, and that's Dr. Ruth Peterson. She's a board-certified OB/GYN with training and experience in preventive medicine and health system change, public health, disease prevention, community engagement, and it goes on and on. Dr. Peterson has served in North Carolina and she was the section chief for the Chronic Disease and Injury section in North Carolina since 2009. So we're just delighted that we were able to steal her from the state of North Carolina. And we're looking forward to working with her in the next month or so, discussing our strategic plan in breastfeeding with her. And it sounds like she's a real supporter of breastfeeding, so we're really excited about that. And it was very sad for us to say goodbye to Kelly Scanlon in June. Kelly was our former nutrition branch chief. So right now we're without a permanent branch chief, but we're in the recruitment stage, and the selection committee has been interviewing candidates, so hopefully we'll have a permanent branch chief soon. So moving on to more of our data and programs that both Sade particularly talked about, I wanted to inform you that, as you know, CDC's breastfeeding rates come from the National Immunization Survey that's managed not by us, but CDC's Immunization Services Division. So the new breastfeeding rates among children born in 2013 that are reflected from the NIS survey data from 2014 and 2015 were released on CDC's website last week in support of World Breastfeeding Week. Most rates increased slightly at the national level, with currently 81.1% of infants initiating breastfeeding, 51.8%, and 30.7% breastfeeding at 6 and 12 months, respectively. And the data are available on the CDC website. That's the www.cdc.gov/breastfeeding, and then go to data, and you will find that NIS data there. And some of you might have noticed that individual states have changed slightly in their rates, but these rates are within the confidence intervals. But if you have questions about your particular state, please contact Carol McGowan if you have any question about your state's new breastfeeding rates. The CDC breastfeeding report card for 2016 will be released sometime in the next few weeks. And for the first time ever, the report card will include data from Puerto Rico. And related to our MPINC survey, that is the maternity practices in infant care, infant nutrition and care, the 2015 MPINC survey was completed with a total of 2,572 birth facilities participating. So that's 82%, and we've continued to be in the 80 to 82% of hospitals reporting in MPINC since its inception in 2007. CDC's analyzed the data and now is in the process of producing 2,572 individualized benchmark reports. And those are shared with each participating facility, and they're tailored to that facility. And we're planning on those going out in late summer, which we have a few more weeks before summer's ending, and maybe it may go into September. We're really excited that the overall MPINC score has increased from 75 in 2013 to 79 in 2015. And we're also working on putting together state reports and web tables of items included in the MPINC score. And this year's state report will highlight trends in the MPINC total score from its inception in 2007 through 2015. Two recent publications from our office, or from authors of our office, we wanted to bring to your attention. One is in the Annual Review of Nutrition, the July 2016 issue. There's an article summarizing the association of lactation with women's cardiometabolic health, which include diabetes, hypertension, and cardiovascular disease. And then just this month, in the August issue of the Journal of Women's Health, there's a summary of the 5-year progress since the Surgeon General's call to action to support breastfeeding that was published in 2011. So those are two publications that were off our office at DNPAOs. And that's the end of my update, and I'd be glad to take questions if anybody has those as well.
Great. Thank you, Paula. It's so exciting to know about that, and also to hear what a great response to have that that percentage of hospitals responding is really quite phenomenal, and to know that the scores have improved, so we'll be waiting. I know that the states really like their state reports as well. So thanks for all the work you do. We all do, Ms. Kelly, but we are very excited about the new changes and your incoming, and we hope that the branch chief position of also done soon. So
yes,
thank you, Paulette.
We do too. Yeah, thank you.
And moving on, we have just one, as I said, be sure to join the Coalitions Committee, our USBC Updates. We just wrapped up our conference from 5th to 7th, and yesterday was our Advocacy Day, so we had over 300, almost 350 attendees for our conference. Thank you for those of you who presented to make it such a success. This is National Breastfeeding Month, so happy National Breastfeeding Month to you all. There are many, many events that are being planned across the country. So on Tuesday, we have a Twitter chat. On Thursday, we have a virtual town hall meeting, as well as on August 23rd, we will be sure to send you notices about that. And I'm going to, as we close, I'm going to ask that Sade show us the information about their webinar series starting August 31st. So do make sure that you all sign up for this. This is going to be a really good one. And with that, it's time for us to close. So thank you all so much for being on the call. Thank you to our presenters for doing such a great job and giving us so much resources to, and do know that the USBC website is a place where we link all of these partners as well. So you can come to our website and find all the action that's happening in breastfeeding across the nation. Join our learning communities. Thanks for all you do, and until next time, goodbye.